Have you ever gone to a psychologist or thought about it? Do you know how to tell if your psychologist is good or meh? Want to know what to look for in a psychologist? I'll guide you through some key points to look for so you can spot a great psychologist. Hi, I'm Joey, I'm a psychologist myself, and I hope a good one too. Today with a video about what makes a good clinical psychologist. And before we dive into the topic and address specific key points, I want to make clear that there are many characteristics that contribute to this goal. I tried to pick some of the most important ones. Herefore, I talked and discussed with a bunch of other professionals that have way more experience than me in this field, and I complemented this information with my university notes. To kick off the video, let's start positioning ourselves knowing what the main goal of the clinical psychologist is. Helping you. This can range from just listening to actually treating and alleviating disorders or other maladjustments. And in all cases I can think about right now, a good rapport is needed for good treatment. But what the fuck is rapport? Well, rapport is a good understanding of someone and the ability to communicate well with them, according to the Cambridge Dictionary. Or according to one of my professors, it could be described as the level of comfort and ease shared between individuals in communication, making the interaction flow smoothly and naturally. Therefore, to create a good rapport and help efficiently, a good psychologist should be a lot of things, starting with ethics and professionalism. There are laws and there is a code of ethics all mental health professionals must strictly follow. Wouldn't be too bad if your therapist would stick to these obligations. These include being properly trained in what they're doing, showing the patient respect, and keeping all of the information private. Talking about the patient doesn't matter to whom. Your mother, my mother, his friends, his daughter is a big no-go. Just in some very exceptional cases, this confidentiality can be broken. I will make a separate video, a more detailed videos about cases when confidentiality can actually be broken, and link it here if I remember to. But in general terms speaking, if no one's life is in danger, your information is safe. Communication skills and being accessible. Good communication is essential for building that rapport we talked about. Knowing what to say, when to say, and how to say it verbally and non-verbally is essential for building trust and comfort. As a patient, you want to feel comfortable and understood, otherwise it will be hard to share your deep personal thoughts and feelings. This includes knowing how to approach complex topics, but also includes things such as organizing the session time efficiently and ending each session appropriately. Also, as a psychologist, if you communicate information and the patient doesn't understand you, you have to be able to change the way you explain it until the patient comprehends. You cannot force the patient to understand. The psychologist needs to try all possible ways until he reaches the patient. And this can sometimes require some time, which would bring me to the next point. Being patient. Apart from the point that we just mentioned, that sometimes, well, it just takes ages to explain the most simplest of information, there are other things that need patience too, because it's completely normal to have ups and downs. It is normal that you're not always moving forward, that you have times where you just don't make progress in life and even step back. And as a psychologist, I want to emphasize how important it is not to get frustrated, neither you nor the psychologist. And every good psychologist should be patient and help regardless of the step backs you make. If, for example, a person with a drug problem relapses after being sober for 6 months, no psychologist should be frustrated or make the patient feel bad for it, because that just does not help at all. Remember that the psychologist's job is to help and not blame or judge. Also, no professional psychologist should ever ever tell the patient that he is the problem, that he is not putting in the necessary effort. That's just a bad psychologist. Don't get me wrong, maybe he is not putting the necessary effort, and in psychology, the patient is the one working and solving the actual problem, and the psychologist is just, well, chilling. I mean, guiding, supporting, and giving the necessary tools for the goal to be reached. But the problem is not the patient. That's a fucking awful way to approach the problem. It's the psychologist's job to find a way to motivate the patient and find the right resources, even though there are patients that are, well, a hard nut to crack. And what we need here is empathy. Maybe the most obvious point in psychology, and yeah, psychologist has to be empathic. And I know what you're thinking. Thanks, Joey, for this precious insight. Well, you're welcome. But empathy is very important because there is no such thing as a one-size-fits-all solution in psychology. Each individual is different, and therefore each solution is different. This goes very in line with what I just said in the previous point, that it's the psychologist's job to find a way to motivate the patient. Well, and for that, you need to understand the patient. Also, I want to take this opportunity here to tell that since we all are different, keep in mind that you don't have to take all advice people give you that seriously. Empathy, therefore, is a keystone in therapy. It helps to understand the feelings, emotion, and ways of thinking. Understanding the thought processes of the other person helps to find a tailored solution for each individual without judging and without imposing our own opinions. And not imposing our own opinions is very important and related to the next point, open-mindedness. So being open-minded means avoiding biases, stereotypes, preconceptions, and beliefs. Being open to new ideas and new ways of thinking. And what this actually means is that being aware of your own stereotypes, preconceptions, and ways of thinking, and so on. Because every one of us has its biases and stereotypes and so on. And it's not even bad, it's normal. It's how the brain works. It's adaptive. Like, imagine going through an empty street at night and suddenly you see a group of 3 women wearing colorful light dresses, looking at the same phone and giggling all together. How do you feel? And now imagine the same situation, but instead of these 3 women, you see a tall, muscular guy with dark clothing, a big scar on his face, a knife on his belt, and a straight face. A totally different situation, right? I admit my example is maybe a bit extreme, especially the knife. But the essence is the same. We don't know these people and we have preconceptions. Don't get me wrong, I would personally definitely change the sideward on the big dude. But maybe he's a sweet, nice, huge grown man coming from a cosplay party. On the other hand, these 3 suspicious looking women who could be assassins working in a group and taking me down in less than 10 seconds, and they're giggling because I'm their target and they found me, and I mean, what the fuck do I even know for sure? Either way, our brain works the way it works, and I will probably make a different and separate video about stereotypes and thinking biases. But for now, it is essential to know about their existence in order to avoid too big of an impact when treating with people. Because while these preconceptions may or may not be adequate, they definitely never help us understand the full version of the other person, due to us filling out some blank spaces and therefore not asking about them. So, how do we get more open-minded? Get to know the big guy. Well, metaphorically speaking, please don't get yourself in trouble. But the idea is to step out of your comfort zone, this place where you feel protected from the unknown. Explore the world, question what is happening in the world, discover and dive deeper into what is foreign to you. Ask fucking questions. That's how you become more open-minded. Active listening. So your ideal psychologist should be listening, but for real. Like trying to understand the other person, not just pretending to listen. Therefore, you not only focus on the words, but on the context. What somebody is saying and how. basically listening with all your 5 senses. Also, you should not interrupt someone, and you can go even further and work with the silence, giving space to unfold. Often we fill these silent gaps in the conversations because they are uncomfortable for us. You know that feeling. Even when in reality they don't have to be uncomfortable and can actually be helpful in creating a great conversation. You would be surprised how much more someone will tell you if you just wait a few seconds. That doesn't mean though that your psychologist should never interrupt you. There are some folks that love speaking and talking, just never stop. You probably know these people too. And the fact that you're paying and that the time you have with the psychologist is limited, well, kinda obligates him to interrupt you, steering the conversation back to the main issue. So active listening is good listening, but it also includes a feeling of interest. And this would be the key point here. You want to see that the other person is interested in what you're saying and not just listening because they're getting paid to. And even though they get paid to, a good psychologist should be genuinely interested in understanding and helping you and not just pretend to. Next point. Continual learning. Would you like to get a hole drilled in your skull to let the evil spirits free? Yes? Well, too bad, because science has evolved and we don't use this technique called trepanation anymore. Well, at least not for the evil spirits. And while this particular therapy may seem kinda obvious not to be the most efficient one, there are certainly modern therapy that could be improved or could be counterproductive, and we just don't know yet. So let science evolve and make sure your therapist is up to date, so you don't get a treatment that science has proven to be bad for you, like psychological debriefing right after an accident or traumatic event. Has not the best record. And finally, refer when necessary. Each psychologist must know that he cannot solve every problem and that he or she will not always be helpful. So suppose the therapist is, for example, emotionally involved in a patient's problems without being able to separate his own experience, beliefs, or feelings from the ones of the patient. In that case, we have a problem because we get too subjective. On the contrary, if the therapist doesn't give a single damn about the patient, well, that's a problem too. You remember empathy and stuff like that. We also don't want to prefer one person over another, in couples therapy for example, where we may agree with one person's perspective, or maybe we hate the way person A treats person B. We have to make sure that we stay professional. And as I mentioned several times, and I hope you remember this, we just cannot judge the other person. So if we do so, we have to refer. And the rule also applies when we get stuck or just don't know anything about the topic in question. When the therapist doesn't know how to treat a specific problem, or when his method just doesn't work and he's trying out some random stuff, well then, he's basically stealing your money. It can be tough to tell when this applies or not, since each therapy is special and takes some time. No psychologist looks you in the eye and knows 100% certainty what therapy will work. It's a process. But there is a certain point where the therapist and the patient notice that the therapy just goes in circles. At this point, the most professional thing to do is refer to another colleague. So, I hope you could take away some valuable insights from this video. Really hope that your therapist is in line with these points. And remember that skills are not innate. They are cultivated throughout time and practice. So don't be too harsh on your therapist. Do you have any questions, any comments? Leave them down in the comments. I will read them all. Until next time.